Absolutely compelling. Let's go back in live.
Scenario, and let's assume again that Michael Jackson's laying there alive. Conrad Murray leaves for just 2 minutes, as he told the police, and comes back, notices Michael's condition, but has the ability to ventilate and has the ability to treat the patient as a competent doctor would. Would Michael Jackson still be alive?
Michael Jackson would be alive and uninjured.
I want to talk about the chest compressions. You've reviewed Dr. Murray's statement to the police in which he described doing one-handed compressions on the bed.
Yes.
Now, how effective, in your opinion, is a one-handed compression to a patient on a bed?
Not at all effective.
And why is that?
The problem with performing CPR, chest compressions, on a bed is that when you push on the chest, the patient just sinks into the cushion. You have to actually compress the thorax. You have to actually move the sternum against the spine and the back to squeeze the heart and also to move the blood in and out of the thorax, which is part of cardiopulmonary resuscitation. Just pushing the patient in and out of the bed is not effective. To push correctly, you have to be positioned. The force has to come directly down. If you're trying this with your hand, not only is it you have a very poor mechanical advantage, but it's very hard to push straight down with a one-handed compression. It's always two hands pushing straight down with the patient on a firm surface. So you're not just pushing the patient in and out of the bed, which does nothing useful.
Now, what if Dr. Murray had a single hand under Michael's back and then was compressing with the single hand?
You just can't muster the force that way. You need your body weight behind this. You can't squeeze this. There's no power in that kind of positioning to squeeze something. You need your body. In the course of years of training, done a lot of CPR and been involved in a lot of resuscitation, particularly as what's called a house officer in the early days of my training. And you throw your body into it because that's what it takes to move the breastbone, the sternum, enough to effectively pump blood for the patient.
What should Conrad Murray have done in that situation?
After calling for help,
911.
after calling 911, you would move the patient to the floor so that you're doing the CPR, chest compressions on the floor, and that way the force is effective, and that way you can also position yourself. Essentially, you straddle the patient with your legs, so or you could be on the side, either way. But the point is, with your arms are straight, you're moving your whole upper body to do CPR.